Hello, everybody, and welcome to tonight's webinar. So my name's Ella. Sorry for the delay in starting. We have actually had a major technical issue. So Richa isn't on yet, but hopefully she's going to join us as soon as she can get on. So I'm going to start with my bits and pieces, and hopefully Richa will come on as soon as she can and give you all some interesting information on detoxification. So thank you so much for joining us. And again, I do apologize for the delay in starting. This is our 7th webinar in our brand new practitioner series. And today's topic is all about liver detoxification and those processes that come along with it, what can interfere with liver detoxification, and how we can support it as well from a naturopathic perspective. So I'm the practitioner lead here at DR.VEGAN, and we are waiting for our guest, Richa Puri, who is a functional nutritionist and also an independent prescribing pharmacist. So hopefully she'll make an appearance with us very, very soon. And before I start, I wanted to very quickly mention that our practitioner webinars are intended only for professionals. So that includes trainee nutritionists, nutritional therapy practitioners, dietitians, naturopaths and pharmacists, and they're not members of the public. So if you're not a professional or a student, this webinar isn't for you. I'm sorry. Okay, so that's a nice little picture of Richa there, who we're waiting for. So just to start the webinar, I want to give you an overview of what we're going to be covering today. So one of the things that we're going to be looking at is liver health statistics, liver detoxification pathways, some consequences of impaired detoxification as well. So what to look out for in your client, what symptoms and signs you might see, which you wouldn't necessarily think, oh, that's liver related, but can give you an indication that something isn't quite right. Maybe you need to do some more investigations, some testing, or just generally support the liver. And then we're going to cover those signs and symptoms, and then hopefully Richa will be with us and she can talk about drugs and liver detoxification. That is really her specialist area. Being a pharmacist and a nutritional therapist, she's got a lot of knowledge there. So hopefully we can hear from her today. She's also going to cover the modern detox burden, so what that looks like with all of the toxins from the environment and how they're processed, and the ways in which we can support the liver. She's also going to look at the nutrition needs, and we're going to be having a look at the gut-liver axis as well. And also I'm going to give you an introduction to our Debloat and Detox product, which is a fantastic product. And at the end of this webinar, you will have a chance to claim a free sample of that for yourself to try. And of course, at the end, we're going to be having some time for discussion and some questions as well. So if you do have any questions, please do feel free to add them into the chat box, and I will have a look at the end and answer some of those. So please do feel free to put your questions in there as we go along. Okay, so I'm going to share with you a few statistics. Now, nearly 50% of the population do carry the null variant of the GST-M1. That's the glutathione S transferase M1 gene, impacting phase 2 glutathione conjugation. So that's nearly 50% of the population that have a problem with normal liver processes or have some sort of genetic polymorphism on that gene. And that's a lot of people, actually. And 50% of your clients could be experiencing these problems. So it's definitely something that you need to be aware of and know the signs and symptoms of, and just kind of get to grips with liver health and detoxification and how the liver works, to kind of spot these signs and symptoms and understand when your client needs a little bit more support in that area. Okay, so there's an incredible amount of premature deaths. So 10,593 premature deaths under the age of 75 from liver disease were recorded in England in 2022. So that's over 10,000 people in just 1 year. So that's a lot of people, and that's not just a little bit of a liver impairment that's causing a problem, or a little bit of liver disease. That's deaths from liver. So this is like serious, hardcore liver issues that is causing these people to be so incredibly unwell, and unfortunately pass away. So again, another shocking statistic, and that is from the official government UK statistics website. Okay, now here is where it gets interesting. Okay, so as you know, technically there's 3 phases of liver detoxification. So phase 1 and phase 2, which you've probably all heard of, and of course phase 3 is then the elimination of those toxins through the bile, and then through the bowel, or through the kidneys and through the urine. So really there's phase 3. We are going to focus mostly on phase 1 and phase 2 today. We might touch a little bit on phase 3, but phase 1 and 2 is, you know, kind of the nitty-gritty of what we're going to be getting onto today. Okay, so in phase 1 detoxification, toxins are split from any conjugates and essentially made more toxic. So it sounds counterproductive to the body that, okay, we've got this toxin, we're going to detach it from whatever it's detached to and make it more toxic. Doesn't really make sense, but it's a process that has to happen in order for the body to conjugate it to amino acids later on, which we'll talk about that in a minute, and then excrete it from the body. So that process has to happen. And there are certain nutrients required for that phase of for phase 1 liver detoxification. And these include riboflavin, which is vitamin B2, pyridoxine, which is vitamin B6, folate, cobalamin, which is B12, and glutathione, which your body does make itself, although you can supplement with it, but there's, you know, some argument on how effective that is. Your body also needs branched chain amino acids, of course, for amino acid conjugation. That's an essential part there. Also needs flavonoids and phospholipids as well. So here, you know, we see it's really important that even for, you know, phase 1 liver detoxification, that you do eat a wide range of foods, fruits and vegetables, plant foods, to get those flavonoids in there as well, and also those phospholipids, so foods containing phospholipids as well. So it's really important to have that diverse and well planned out diet. So you also need another set of nutrients for intermediate metabolites. So these include things like vitamin A, vitamin C, selenium, zinc, copper, manganese, and coenzyme Q10 as well as thiols, which are found in things like garlic and onion, and also cruciferous vegetables as well. So it is, like everybody says, it's important to eat your greens, but actually it's really, really important to eat your greens and your cruciferous vegetables to support the liver processes, and that is basically one of the foundations for health, along with obviously gut health. You also need those intermediate metabolites. For those intermediate metabolites, you need bioflavonoids as well, and proanthocyanidins. So again, this is where your bright coloured, your deep red, your red, pinky berries come in, and those kind of bright coloured foods. So again, we say eat the rainbow, and it's for a reason, and it's for the very basic processes of detoxifying the liver, as well as many other things. And also silymarum is very useful for this pathway as well. So we'll talk about silymarum a little bit more in depth later on, but it does help to support phase 1, phase 2 liver detoxification. But interestingly, silymarum also helps to protect the liver cells from its own toxins. So there's loads of toxins going through the liver all the time. You know, that's the liver's job, main job basically. And sometimes the liver cells can become damaged from those toxins that it's detoxifying. So silymarum can protect the liver cells, and also there's been some research to show that silymarum can help regenerate those liver cells as well. So, you know, milk thistle, that's really the main source of silymarum. So, you know, if you can supplement with that, or your clients need it, it's a really good, useful herb to use. I have to say that it's very strong in Sidimarum is strong in milk thistle seeds. So some people do get the seeds and sprout them themselves, add them to things like salad, and that's a really good way to get it in your diet as an everyday diet. Okay. So we've got a nice little picture here as well. So you can all take a screenshot of that or take a photograph on your phone and have a look at that later, exactly all of those nutrients needed and the reactions that occur in each phase of the liver detoxification. And I will very quickly, before we move on, I will very quickly discuss phase 3 detoxification as well. So obviously, once you've got those toxins, it's really important that the gut is working properly, because a lot of the toxins get put out into the bile, or either they get sorted out through the kidneys and then put in the urine. So you've got to be drinking lots to help flush out those toxins. If you're dehydrated, your body isn't going to be doing an effective job at getting rid of those toxins through the kidneys and through the urine. And again, if you're constipated, you haven't got that bowel movement, those regular bowel movements, you're going to be not getting rid of those toxins quick enough and potentially reabsorbing them as well and giving your liver twice the amount of work to do. So it's really important that, when you're helping your clients to look after the liver, one of the things that you do look at is actually, are they excreting their toxins through the bowel effectively? Really, people should be having 2 to 3 bowel movements per day. And if they're not having 2 to 3 bowel movements per day, then you need to kind of help them, give them some probiotics, make sure they've got a fiber-rich diet. Are they exercising? Is there anything else that could be causing a sluggish bowel movement, lazy bowel? These are all things that you need to look at the same time as looking at the liver. And of course, some nutrients that we can add to the diet can help to bind bind those toxins and help carry them out. So really, you want to be giving them a really good fiber-rich diet. And if they're struggling to get fiber in their diet, you can always give them a fiber supplement as well. That's going to help to bind everything and carry it out. So we've got those 2 phases there, and then you've got the phase 3, which is obviously looks a little bit different and requires a different course of action there. Okay, so here is where it gets interesting. So this is phase 2 liver detoxification on my screen here. So you've got glucuronidation, you've got sulfation, glutathione conjugation, acetylation, amino acid conjugation, and methylation. Now we're going to go through each of those and break it down and look at kind of what nutrients we need for each section. Okay, so in phase 2 liver detoxification, toxins are conjugated to amino acids. So basically they're bound and joined up to amino acid, and this makes them less toxic. So don't forget, as I mentioned earlier, in phase 1, they're unbound from whatever they're bound to. And then in phase 2, they're bound again to amino acids so that the body can process them in its own way. And binding them to amino acids also makes them more water soluble and ready for excretion as well. So that makes them much easier for the body to process and get rid of. So this is why the liver does that. So there are, these are the processes here on the screen. So the first one is glucuronidation. So in glucuronidation, glucuronic acid is attached to the toxins, so mostly to drugs, steroid hormones, bilirubin, non-steroidal anti-inflammatory drugs, paracetamol, and that requires magnesium to function properly. Now, the amount of people I see in my clinic which just do not have enough magnesium, it's really outstanding. And to be honest, I don't think I've met anybody apart from other nutrition practitioners that actually do get enough magnesium. If you think about the things that leach magnesium from the body, so it's stress, sugar, caffeine, or smoking. Nearly everybody I know has at least one of those, stress being the major one, and then caffeine obviously being another major one, and sugar. And obviously there's plenty of people that smoke out there as well. So this all leaches magnesium in the body because the magnesium is required to deal with those toxins, and then that leaves less magnesium for the rest of to deal with the rest of the toxins and to support kind of drains it from the liver supply, if that makes sense. So it's really essential to get your nutrition right and get your foundation. So even adding something like magnesium is going to help with glucuronidation. And if somebody is on medication, especially long-term medication, things like steroid hormones, or so like maybe they're on the contraceptive pill or HRT, or other hormones that you can have in medication form. But also if you're struggling to deal with your own hormones as well, so if you're not on any medication but you have maybe endometriosis or polycystic ovary syndrome or estrogen excess, then something as simple as putting in magnesium is going to support glucuronidation, and then it's going to help with that pathway. Okay. Sulfation. Okay, so in sulfation, we add the liver adds a sulfate group to hydroxyl amine substrates via sulfosyltransferase enzymes. Okay, and the toxins that are dealt with in sulfation include also steroid hormones, so estrogen, thyroid hormones, and also phenols from additives and certain drugs and from food as well. So certain neurotransmitters as well are detoxified through the sulfation pathway. So dopamine, serotonin metabolites. So, if somebody does have, if their serotonin, their dopamine isn't balanced, and it's kind of sometimes high, sometimes low, I'm thinking of a few mental health issues that people can have where dopamine and serotonin are completely dysregulated. So maybe things like bipolar and a few other issues. Look at sulfation. Is sulfation working properly? Because if they're not able to detoxify those hormones effectively, then how is their body going to regulate that? And that could potentially lead to some mental health problems or issues there. Okay, so for sulfation group, we need sulfur-containing amino acids. So these are methionine and cysteine. And also you need vitamin B6 and molybdenum. So really important to make sure that people are eating enough protein, getting those amino acids in there, as well, of course, B6 and molybdenum. Okay, so the next one we have here is glutathione conjugation. And glutathione, so glutathione conjugation obviously requires glutathione to detoxify reactive intermediates such as carcinogens, heavy metals, and also peroxidized lipids. Now, what I will say is the body obviously produces glutathione itself. So as I mentioned earlier, you can take it with supplements, but there's some debate on whether that glutathione is effective by the time it gets absorbed into the body. So in a way, it is better to kind of support the body with the nutrients that you need for glutathione. So things like selenium and a few of the amino acids as well. So really kind of supporting, making sure that their diet is rich in the nutrition they needed for creating glutathione, which can then go on to detoxify things like heavy metals and carcinogens as well. So so if you look at the statistics, unfortunately 50% of the population will get cancer at some point. So we need to be making sure that glutathione conjugation is working properly so that we can get rid of those carcinogens and help to protect the body from the negative effect of those. So glutathione conjugation is particularly good at getting rid of mercury and lead. So if anybody does have any mercury teeth fillings or anything like that, so quite a lot of people do have them now. I know they're trying to get rid of them, but they are in quite a lot of mouths. And of course, every time you have a hot drink, that releases a tiny bit of methyl mercury into the body. So really important that anybody that's got any metal or mercury fillings in their mouth does have a properly functioning glutathione conjugation pathway. And also metabolites, most people like to have a drink every now and then, some people more than others. But again, you need glutathione conjugation to support your body in detoxifying these metabolites from alcohol. And now I'm not sure if this is going to help with a hangover, but I know certainly that silymarin does help with helping to prevent and improve hangovers. So this could potentially be one of the ways that it works. And also glutathione conjugation is essential to help protect the body from the free radicals from phase 1 detoxification as well. So as well as glutathione and all those nutrients, you need things like cysteine, glycine, glutamine, and selenium. So that's really going to support that pathway there. Okay, acetylation. So acetylation adds on an acetyl group to substrates such as histamine and caffeine using acetyl coenzyme A. So, of course, acetyl coenzyme A is directly dependent on vitamin B5. So not only do we need plenty of B vitamins for this pathway, but we need to make sure kind of your body is converting the B5 properly and using it. So obviously making sure that digestion is really good to get the most of those nutrients. And people that have high histamine levels, like hay fever, allergies, atopic dermatitis, chronic rhinitis, these are the people that are going to be struggling with acetylation. And also people that struggle with caffeine as well. So people that can't drink caffeine in the morning and sleep at night, you really want to be looking at acetylation and those pathways and making sure that they are consuming enough B vitamins and especially vitamin B5. Okay, so we've got amino acid conjugation here. So amino acid conjugation combines toxins with glycine, taurine, glutamine, and this also helps to, this pathway that helps to detoxify pesticides as well. So as nutrition practitioners, I'm sure we try to get everybody to eat organic, but actually, as you know, that's not always possible. The organic food isn't always available. So you need to make sure that this pathway is working effectively and you are consuming enough amino acids for it to function. Okay, so this pathway also notification. I hope everybody can hear me. Okay, sorry about that. I don't know how long I was off for, but I was just kind of talking about all the toxins, benzoates, salicylates, and all of the things that all the toxins that amino acid conjugation helps to deal with. And for these, you need glycine, taurine, and glutamine. So again, make sure that your clients are consuming enough protein for the liver to function properly, because if they're not, amino acid conjugation is going to be not effective, basically, and you're going to struggle with some of these toxins. Okay, and finally here we've got methylation. So methylation, so it attaches the methyl group via SAMe. We'll talk about that in a little bit more depth later on. But SAMe stands for S-adenosyl methionine. And it adds that to toxins and hormones and phenols as well. And so methylation also helps to deal with estrogen and histamine as well. So again, this is another thing that you want to look at. If somebody has an estrogen dominance or histamine intolerance or just too much histamine in general. It also supports heavy metals as well. So great for anybody that's got heavy metal toxicity, always been exposed to those heavy metals. And for this pathway, we need folate, we need vitamin B12, and again, SAMe, which is S-adenosyl methionine. And of course, that's synthesized from methionine. So it's you need to make sure everything's working properly and you've got all those nutrients so that your body can synthesize it from methionine. So you need things like B12 and folate. And also you need choline for this pathway as well. So choline is really good supportive liver and can support methylation. But I would say just one thing before I move on to the slide. If any of the, any of your clients are having problems with any of these detoxification pathways, get the diet sorted out first, because get the diet sorted out, and then when they're coping with the diet, add in the supplements, because if you put in supplements or kind of speed things up too quickly, it can make people quite unwell. So make sure they've got all the nutrition in their diet, and then 3 or 4 weeks, if they're feeling fine, add in supplementation to kind of support the liver a little bit further. But I wouldn't do it all in one go and make somebody ill. Okay. Let's have a look at the next slide. Okay, so let's have a look now at the consequences of impaired detoxification. So when detoxification pathways don't function properly, you get an imbalance between phase 1 and phase 2 liver detoxification. So if phase 2 isn't, if all those pathways aren't working properly, you know, you kind of get those toxic metabolites from phase 1, which then don't get processed properly into phase 2, or there becomes a backlog. So that can be quite problematic. So again, you know, if that's sluggish and we see an increase in these toxins, that can make somebody really ill, make them have lots of unpleasant symptoms, and we will go over the symptoms, you know, in the next couple of slides. But you know, you've got to get those two systems, phase 1 and phase 2, regulated. Of course, you know, the phase 1 toxins are very highly unstable and they can damage DNA, proteins and lipids. So of course, if you're damaging DNA, then obviously, you know, that can contribute towards health conditions and cancer, which isn't great. So it really is in everyone's best interest to get those regulated. So you've got DNA and proteins, and hi Richa, how are you doing? Can you hear me, Richa?
Hi, I'm okay.
Good. I'll just finish
Can
off
you hear me?
Yeah, I'll just finish off these last few slides and then I'll hand over to you, Richa. You can give yourself a introduction then.
Thank you. Sorry.
Okay, yeah, no worries, it's fine. So yeah, so you really want to be making sure that those liver detoxification pathways are working effectively. Okay, so let's go on the next slide there. Okay, so also things like, you know, pathways like glucuronidation and sulfation, if they're not working properly, estrogen isn't cleared properly, which can lead to, of course, estrogen dominance, and that could potentially drive, you know, estrogen related cancers. So you want to be really careful with that. And also it can cause impaired detoxification of histamine, leading to histamine related conditions. Okay, so of course, you know, things like increased histamine sensitivity, you know, it's really important to make sure that all those processes are working properly. And if histamine is linked to a number of health conditions, so even gut issues can be due to histamine sensitivity. So you've got those enzymes there. So you've got DAO, which is diamine oxidase, and then you've got the HNMT, which is histamine and methyltransferase, and they need to both be used to break. They need to break down histamine, so they're both useful and helpful for getting rid of histamine. Otherwise, that can build up and cause issues as well. And clinically, you know, this presents as things like rash aches, headaches, rhinitis, and flushing and anxiety. And of course, the other issue as well is ammonia accumulation. So if you're not detoxifying ammonia properly, you know, that can cause major issues, and that can be picked up on a blood test. So just make sure you're getting your client's liver tested on blood as well. Okay, so elevated ammonia. Let's go to the next slide. There we go. So elevated ammonia is toxic to the brain and can cause things like brain fog, fatigue, irritability, and in severe cases, hepatic encephalopathy, which is a neurological and cognitive disorder caused by liver disease. So nothing wonderful, really, all pretty horrible. So make sure that you are looking out for increased ammonia as well. Okay, and lastly, we often see an increase in beta-glucuronidase activity due to gut dysbiosis. And I think Richa is going to talk a little bit about that later on, so I won't spend too long on that now. But beta-glucuronidase can deconjugate estrogen from toxins in the gut and allowing them to be reabsorbed instead of excreted. So you need to really get that gut working properly and get any dysbiosis sorted out, so that doesn't happen. And you can measure beta-glucuronidase on the stool tests and things, so that's a good thing to look out for as well. Okay, now quickly, I'm just going to go over some signs and symptoms of signs and symptoms that your liver isn't working properly. So you've got neurological symptoms. These include things like brain fog, poor concentration, mood swings, headaches, depression, insomnia. And then you've got skin conditions such as eczema, psoriasis, acne, hives, unexplained rashes, flushing and itching. And of course, we've got bloating, constipation, nausea, food intolerance, a bitter taste in the mouth, and intolerance to fatty foods as well. And as discussed earlier, with histamine intolerance, mast cell activation, and autoimmune flare-ups, as well as muscle aches, fibromyalgia type pain and joint pain, PMS, irregular periods, endometriosis, estrogen dominance, low libido, and fatigue, especially after meals. So that's a big red flag for the liver if somebody's eating and then promptly falling asleep or just feeling very tired. Poor stress tolerance, alcohol intolerance, chemical sensitivity as well. And then you've got cardiometabolic, so increased oxidative stress and inflammation, and elevated homocysteine, and that can be due to decreased methylation. Okay, and we've got elevated enzymes as well, such as GGT, ALT, AST, bilirubin, hepatomegaly, stenosis, and tenderness over the right upper quarter as well. So they're things you'd more likely to see on a blood test from the doctor. And of course, if someone's feeling tender over their liver, that's also a big flag. Okay, Richa, I'm so glad you joined us.
Hello, thank you
hi.
everyone. Thank you, Anna.
No worries. Do you want to give us a quick introduction to yourself and then go through your bits and pieces?
Yeah, so sorry everyone, lots of technical issues on my end joining, but I'm very glad to be here. So thank you to Dr. Vegan, thank you to Ella for asking me to join today on the webinar. So my name's Richa Puri. I'm a pharmacist by background, so nearly 20 years working as a pharmacist. I've had lots of different roles, including working in community pharmacy, as well as working in general practice. I've run diabetes clinics, anticoagulation, and one of my key roles was carrying out complex medication reviews, which is going to be quite important for this webinar, and particularly for elderly patients and those with multiple conditions and on lots of different medications. I'm now a lead practitioner in general practice and I run a menopause clinic. And I'm currently doing my certification for the the controversial weight loss medications. So I'm an independent prescribing pharmacist, which means I can prescribe various medications. Mostly it's hormones, and then some others, including metformin and antibiotics for things like vaginal and seminal microbiome issues. I'm also a nutritional therapist, functional medicine practitioner. So I've integrated all of these roles together, and now I've got my own private practice. So I've specialized in women's health, hormones, fertility, and I also have a huge interest in longevity and health span. So so extending life and aging well and without disease. And yeah, so I'm just going to carry on now. So I will get started. Okay. So the modern detoxification burden. So as we can see here, we are surrounded by toxins in our everyday life. Some of those are what we call endogenous toxins. That means we produce them internally ourselves. That includes things like hormones, reactive oxygen species, ammonia, which Ella's just touched upon, and those which are exogenous. So that's what we are ingesting from our environment. So we could be doing this knowingly, things like alcohol, but there's also things like pesticides in the environment. There's the skincare products we use, cleaning products. We are literally surrounded by a toxic soup. And then medication does then add to this strain, and particularly, as I was saying, if there's lots of different medications that people are taking all at once. So in this 21st century, we are under constant liver stress. So our liver is just constantly working to process all of these chemicals that we are exposed to on a daily basis. So next slide, please, Ella. So here we have medications and detoxification. So mostly all medications go through this P450 enzyme route for detoxification. Some medications have the ability to speed up this process, the metabolism process, and cause more reactive intermediaries, the intermediary products that are formed when it speeds up. So these are known as what we call enzyme inducers. So some examples of these are rifampicin, which is a very potent antibiotic. So we don't typically see this in our everyday practice. And it's typically prescribed from a hospital setting. Phenytoin is an anticonvulsant or an anti-seizure medication and used in epileptic patients. So we might see this more commonly as nutritional therapists working with our clients. Enzyme inhibitors are those which slow down the process. So therefore, if the metabolism process is being slowed down, it just means that there can be more toxins then building up because they're not getting eliminated or detoxified. So some common ones of these are erythromycin. So this is a more common antibiotic. It might be prescribed for things like respiratory tract infections, and the GP can very readily and easily prescribe this. And then cimetidine. So cimetidine is similar to a proton pump inhibitor. So it slows down the production of acid from the gut. So that could be, again, something that we will see more readily in practice. And then there are medications which are literally directly hepatotoxic. So that means they are toxic to the liver. So paracetamol is a very well-known one for this. So the reason that this happens is because it uses up glutathione stores to be eliminated. And so if we've got genetic SNPs and we're not able to produce enough glutathione, that can obviously cause a buildup of paracetamol. But the other thing is, if it is taken in excess and above those prescribed licensed doses, it can actually be very, very toxic for us. Statins are another one, and then methotrexate. So methotrexate is a drug which is prescribed for transplant patients, and it's also commonly prescribed for rheumatoid arthritis. It is hugely liver toxic, and one of my other roles was to monitor patients taking methotrexate. So they do need blood tests. Initially, they need them every 1 to 2 weeks when they're first started on the medication, and then once they're stable, they can have blood tests every 3 months. And once they're what they're checking for is liver function, kidney function, and then a full blood count is also done. So every 3 months without fail, they need these blood tests. And the other thing to note about methotrexate is actually it does deplete folate levels or folic acid. So, and again, why this is really pertinent is obviously Ella's been talking about the various detoxification pathways. One of those is methylation. And so if we are depleting things like folate, we're putting methylation under strain, or the liver detoxification under strain. And that again is going to cause a buildup of toxins in the system. And then we've got polypharmacy there. So the word poly just means many, and then pharmacy is drugs or medication. So the more drugs we are prescribed, the higher the accumulation of drugs, the more demand there is going to be on the liver to detoxify. Next slide, Ella.
Okay, just 1 second. Let me just, there we go. Can you see that?
Yeah, brilliant. So, so the liver is it's the primary detoxification organ, but there is a huge connection between the liver and the gut when it comes to detoxification and elimination. So once things are processed via the liver, via these cytochrome P450 pathways, and they're made more water soluble, and then they go via the conjugation process, those bound toxins are then sent to our gut for elimination. And so if the gut isn't working effectively, if we're constipated, again, that means there's going to be a buildup of these toxins and chemicals in the system, and we're not going to be able to excrete them efficiently. And though we talk about phase 1, phase 2, phase 3 elimination and detoxification, actually we need to work backwards. So we can't be supporting our liver for clearance and getting rid of toxins if our gut is not working efficiently. And by that, we really want to make sure that our clients are opening their bowels every single day, and that it's a consistent bowel movement, and that it's a good stool that's being formed as well. And then obviously if there is any issues with any of these stages of detoxification, then that can present in the symptoms that Ella was talking about. So things like fatigue, one of the huge ones with liver and gut issues for elimination is then things get pushed out through the skin, because the skin is also a detoxification organ. So we might then see skin issues starting to appear. And so we can support our bowel movements through things like fiber and probiotics. And, you know, fiber is obviously something that is very spoken about quite a lot at the moment, and just making sure that our clients are getting that 30 grams of fiber every single day, and making sure there is a real variety of our fruits, vegetables, plant-based foods, legumes, and even herbs and spices, etc., to support those bowel movements and the good microbes. Okay, next slide, please.
Okay, no problem. If it's going to work. So many technical issues today. There we go.
Okay, so phase 3 elimination. So it's not just considering the gut. So there are other elimination and excretion pathways. So as we can see here, we've got the gallbladder, which produces our bile. So bile is very important, especially for helping to get rid of our fat-soluble toxins. So it helps to conjugate those toxins, and then that gets again sent via the liver and then via the gut to be excreted. The kidneys, obviously, they helped us to produce urine, so that's really important that they're working optimally. And then another really important detoxification pathway, which sometimes gets overlooked, is sweat. And it says there it's a secondary route, so it's not one of our primary elimination sites, but we do need to make sure our clients are sweating, you know, because it is actually a very powerful tool for helping to get rid of any toxins again. Next slide, please.
Okay, no problem.
Okay. So perimenopause and the liver. So obviously the kind of women's health space, again, like I was saying, is one of my specialisms. So one thing that sometimes us practitioners don't realize is that perimenopause is a time when our estrogen levels can really, really fluctuate. So menopause is a time when we don't have a period for 12 months. And that's when our hormones actually start to really reduce. The production of the hormone starts to reduce from the ovaries. But in that transitionary phase, the perimenopause, which leads up to the menopause, your estrogen levels are really, really fluctuating. And at some points, there can be up to 3 times higher production of estrogen compared to when we are in our reproductive years. So what this means is that the liver is really, really working overtime to get rid of this excess estrogen, as well as all of the other toxins that it's trying to get rid of at that time. And then we add in things like alcohol, skin products, which is what I was talking about, environmental toxins. So again, your cleaning products, even our furniture emits lots and lots of toxins into the environment. And the pesticides and herbicides, etc. So your liver is just really, really trying to work and, you know, get rid of these things. And that can really cause a backup, and that really slows down the liver detoxification processes. And then at this time, symptoms can get a lot worse. So some of those symptoms can be what we call I'm putting it in exclamation inverted commas, that the estrogen dominance, because obviously it's a term that is a bit controversial, but estrogen dominance is referred to when we get things like PMS, mood swings, tender breasts, bloating, like those other conditions that Ella mentioned, such as endometriosis. So if our clients are presenting with these symptoms, then we can think about, what are their estrogen levels doing at this time of perimenopause. Next slide, please. Okay, so this is just a lovely pictorial that I love to use when I'm explaining to my clients. So the one on the left is it shows, your levels fluctuating right from childhood, and then teens, puberty, and then the reproductive years, and perimenopause, and then menopause. And so if we note here, your perimenopause actually mirrors your puberty in terms of the levels of estrogen that are being produced, and also the levels of progesterone are a lot lower during our perimenopause. And so then that disparity between the two causes this estrogen dominance, or what we call unopposed estrogen. So that pictorial is taken from one of my favorite practitioners, women's health practitioners, Lara Bryden, and she's got it from someone called Professor Geraldine Pryor. So she's a clinician out in Canada, and she's done lots and lots of work in women's health. So you can go and have a look at those. And then on the left, it's just a lovely way of explaining, what the liver is going through at this time, and all the different things that are coming in that it's trying to process and metabolize and detoxify and then eliminate all at the same time. Next slide, please. Okay, so just a bit more explaining about estrogen dominance. So we talked about the link between the liver and the gut. So the gut has a collection of microbes in it called the estrobolome. And so again, if we think about the word and break it down, so estro is referring to estrogen, and bolome, is referring to the microbes. And they're all there to regulate our levels and our clearance of estrogen. And then within that collection of microbes is this enzyme called beta-glucuronidase. So Ella touched upon it earlier. So beta-glucuronidase, again, the connection, if we make it, is the glucuronidation of the estrogen. After that happens in the liver, it gets sent to the bowel and to the large intestine. And levels of beta-glucuronidase, if they become too high because of dysbiosis, it's an enzyme. So anything with A's at the end of it means it's an enzyme, and it means it's a cutter. So after that estrogen's been packed up, if it goes to the gut and beta-glucuronidase levels are quite high, it's going to then cut the estrogen from the glucuronidation, and that means that estrogen can recirculate back into our system. So again, if we think about perimenopause, we're producing lots of estrogen. We're then having estrogen recirculated back into the system. It just means that things are going to go a bit crazy for a while. So we're going to get this PMS, we're going to get heavy periods. Some people may get fibroids, the breast tenderness, the mood swings. So it's really, really important that we are supporting all of these different levels and processes when it comes to the elimination. And then on that slide, it says alcohol can really hinder this. So there is a competitive nature between estrogen elimination and detoxification, and alcohol elimination and detoxification as well. And the liver will always preferentiate the alcohol. So again, that's going to mean that estrogen takes a back seat in getting eliminated. And again, it's just going to add into this soup of stuff that is going on, and then it will get eliminated afterwards. And then again, if we think about the nutrients that we need to get rid of these things, again, if we think about methylation and the depletion of things like B vitamins, etc., that's going to cause further havoc and slowing down of the processes of detoxification and elimination. Next slide. Okay, so pharmacist insight, medications in midlife. So yeah, by the time we get into midlife, we might be on a number of different medications. So some of them I typically see are oral HRT. So when we take things orally, it goes through the first pass metabolism in the liver. So it just means that this can aggravate the liver somewhat. And so with oral HRT, there is a bit of an increased risk of things like stroke because it is going through that first pass metabolism. And then the other types of HRT are transdermal HRT. So that goes through the skin and it goes directly into the bloodstream. So that avoids the first pass metabolism, and then the risks and the side effects are reduced quite significantly. Antidepressants, so again, they go through that P450, cytochrome P450 process of elimination. And so again, if people are taking antidepressants, so one of the things to really note is the diagnosis of depression is still really skewed when it comes to perimenopause and menopause versus a true diagnosis of depression. So low mood, anxiety, irritability, even things like rage, etc. These are all really common symptoms of perimenopause. So something I would really go through in detail with clients is it a true diagnosis? And obviously we can't diagnose, but we can really try and help them to unpack this and then maybe get sent back to their GP and, you know, go through it with them in more detail again. Painkillers and PPIs, so proton pump inhibitors, they can cause significant nutrient depletion. Again, what we're talking about in terms of needing things like magnesium and our B vitamins, etc., to help those detoxification processes. So having a medication review and, you know, getting the right nutrients in can be really supportive at this time for our clients. Next slide. Okay, so our hormones, when we have them in our reproductive years, are actually really supportive for us, and they do lots and lots of different things. And one of the main roles of estrogen is that it's really anti-inflammatory. So it does protect us against things like cardiovascular disease. So obviously, as we do progress into menopause and we do, our estrogen production does really lower, this can open up a whole cascade of symptoms, diseases, conditions, and even with the liver. So it can protect against things like fibrosis, which is scarring of the liver, oxidative stress, and inflammation. So it says there, menopause can lead to a loss of protection in lots of different areas, even things like insulin resistance, blood pressure. And so it says we are more than susceptible to things like fatty liver disease, fibrosis, and metabolic dysfunction, which is what I was just talking about, diabetes, non-alcoholic fatty liver disease, and increased blood pressure, and even renal disease as well. Next slide, please. So how can we support our liver on a daily basis? There's so much that we can do. So from a food and nutrient perspective, cruciferous vegetables are incredible. So at least 2 portions of green leafy vegetables every day. So they are the ones that contain sulfur. And then again, if we think about one of the processes is the sulfation process, that obviously supports that. Protein. So protein is so crucial for liver detoxification, and those individual amino acids. We know about things like cysteine, for glutathione production. That's really important. Bitter greens help with bile flow and bile production and the gallbladder to produce the bile. And then hydration. So we talked about things like sweating, and we talked about the role of the kidneys. So, making sure we're really well hydrated again, and also for a good bowel movement as well. Hydration is really key. So lifestyle-wise, sleep. So your liver actually works and does its detoxification at night. So really making sure we are honouring our sleep and getting our clients to sleep at the right times, and getting them off phones and screens, etc. Movement to help that lymphatic production and movement as well. And then sweating again is another one, and there's a lot of information now and data available about saunas as well. So that could be something to look into. And then we've got reducing our actual exposure. So swapping out all of our plastics for glass containers, definitely not heating in plastic, getting rid of coffee cup lids is really important. Trying to go sort of organic as much as possible, as much as is within their means. I've been growing loads of vegetables at home this year, so that's available as well. And then looking at skincare toxins and other cleaning products. So there's lots of good apps like the Yucca app. There's the Environmental Working Group, which is based out in America. They can check their products and then swap them out. And I always say that can be quite overwhelming. So I always say to my clients just to do it. If one product is finishing, then replace that first, and then just do it in a stepwise way to make it less overwhelming. Next slide, please. So here we're just finishing with a few, I'm finishing with a few common detoxification myths. So detox teas and juices, they just don't work, unfortunately. So they may feel like they're working in the moment, but like we've just seen, we need things like protein, we need other vegetables, etc., and other nutrients to really get on top of detoxification. So fasting is an effective method. We've got to be careful with it as women, and also, causing more of a stress sometimes. If there is a rapid weight loss, this can mean we mobilize a lot of toxins from our fat cells, and that again can overwhelm or overburden the liver. So we've just got to do it in a good way. And detox does not mean stopping medication. So this again needs to be done with a professional, with your GP or pharmacist. And detoxification is daily maintenance and not just a quick fix. So it does take time, and we've got to keep on top of it. And I guess as we're getting older as well, that's something that's really got to be considered. And then that's it from me. Thank you, Ella.
No worries. Thank you so much, Richa. That was really, really interesting, actually. And I'm sure that everybody's learned loads from that. I certainly have learned a few things. Okay, so now I want to go with you over our new, it's not new, it's been around a while actually, de-bloat and detox product. Now, obviously this has been formulated to support the liver and to support those that digestive process as well, to help with bloating. So it's kind of a 2-in-1 product. So it is a unique formula, and it's a combination of botanicals and amino acids for digestive related bloating, and helping to naturally remove toxins from the liver and from the body. So it includes things like milk thistle, silymarin, which obviously comes from milk thistle, dandelion root, artichoke, burdock, and L-glutamine. Okay, so let's have a look at the milk thistle. I did mention it briefly earlier. So the active compound in that silymarin, and it does play a role in both liver detoxification and gut health, particularly in cases of where bloating is linked to liver dysfunction or toxin buildup. So the mechanisms of action is in both processes are well supported by the scientific literature. So it promotes phase 2 liver detoxification enzymes, such as glutathione transferase, and these enzymes facilitate the conjugation and elimination of toxins from the liver, and the essential clearing of metabolic waste, really. And again, as I mentioned earlier, it does also protect the liver cells from its own toxins, so that's really a crucial thing there. So support the crucial enzymes involved in cellular detoxification, and specifically a reduction in quinones, so less toxic hydroquinones. And of course, silymarin enhances hepatic glutathione levels as well, so it can increase glutathione, which of course contributes to not only the liver's antioxidant defense, but your whole body's antioxidant defense. And a human study showed that silymarin treatment led to a slight increase in the survival of patients with cirrhotic alcoholism compared to untreated controls. So again, can sometimes be life-saving when used appropriately. And also clinical research shows its benefits patients with alcoholic and non-alcoholic fatty liver disease, as well as cirrhosis. And it can reduce liver-related deaths, which again is really, really a good thing to do. And again, if used appropriately. And obviously, if they are in the hospital, then you have to work with those practitioners as well, that are the nurses and the doctors that are looking after that patient. Can also help to improve glycemic control as well in diabetic patients with alcoholic cirrhosis. So a nice all-round one for liver supporting formula. Okay, so we have in here also dandelion, which is a diuretic cholagogue, and it has quite strong antioxidant properties as well. So it stimulates the production of bile, which obviously is really helpful for putting toxins from the liver into the gut and then getting rid of those through the body, and also helps with the digestion of fats and the elimination of toxins through the body. So many toxins are excreted out in the bile, and that is one way you can support detoxification in clients, making sure that the bile is flowing effectively. So dandelion contains the active ingredient called sesquiterpentylactones, and that's what gives it its bitter taste. I don't know if anybody's tasted dandelion as a leaf, but it's pretty not very nice, pretty disgusting really. It's so bitter, and that's what gives it, that bitter taste. The active is causing that bitter taste, and that's what stimulates bile production. Also stimulates diuretic functions within the body as well, so it helps with the excretion of toxins through the kidneys and through the urine. So another really great all-round product for a liver supplement. We also have in here fennel seed as well, which also has a diuretic effect, and again helps to flush those toxins out of the body and reduce water retention, which can help also reducing bloating. And again, just generally supporting fluid buildup and supporting the detoxification through the renal system. Okay, so we've got the artichoke leaf in here as well. So the active compound in that is called cyrenin, and that plays a supporting role in detoxification and can also help reduce bloating. So it increases bile production as well, and that again then aids in detoxification and the digestion of fats, and helps people just to digest and have more comfortable digestion. So the artichoke contains flavonoids and antioxidants, which also help to protect the liver from damage, oxidative damage, and support detoxification and those detoxification processes. So the benefits of it have been shown through experimental and clinical research and extensive biomedical herbal remedy research as well. So the research has been demonstrated its ability to help protect liver cells and also help liver cells to regenerate and promote digestive health. So again, only a good thing if your liver is struggling. Okay, Schisandra is quite an unusual one, not often seen in liver supplements, but also a really nice addition to Detox and Detox. So Schisandra contains several active compounds such as Schisandrin A, B, C, and Schisandrol A, B, and Schisantharin A. And Schisandra is an adaptogenic herb, and it has positive effects on liver detoxification and liver cellular regeneration as well. So not only does it enhance liver detoxification enzymes in phase 1 and 2, it also supports the breakdown of toxins from the body. And of course, that's essential not only for detoxification, but also reducing bloating and inflammation. That is also sometimes associated with the toxic overload. So research has concluded that Schisandra regulates gene expression of phase 2 antioxidants and helps with phase 2, basically. So again, a really good one to use. Okay, so next we have burdock root. Okay, so again, that's a natural diuretic, and it helps to remove toxins from both the liver and the kidneys. And it's really important also to help reduce fluid retention and bloating, particularly in people with sluggish detoxification pathways. And the active components in that are cholinergic acid, which can, of course, regulate lipid metabolism and helps protect against hepatic cirrhosis, and supports reduces an excessive buildup of waste, which of course can cause gastric irritation. Okay, so next one we've got is glutamine. Okay, and that also plays a really important role in maintaining the function and the health of the gut. And again, that's really important for phase 3 liver detoxification. helps to reduce permeability, excess permeability, and inflammation. It is the main fuel source for the intestinal cells, enterocytes, and so it helps to protect that barrier and then helps general gut function. And also by reducing inflammation, you're helping to maintain a healthy microbiome, which then helps with any issues that could be caused by an overgrowth of bacteria and kind of deconjugating estrogen and these kind of issues there. So again, a nice all-round product and a really good combination. And of course, don't forget to I mean, it goes without saying, but make sure your clients are having a really healthy diet with it. Make sure they're eating your rainbow a day. Make sure they're eating their sulfurous vegetables, green leafy vegetables, and enough protein. Of course, that also comes with it. And then adding in the additional supplements. And of course, as Richa suggested earlier, looking into things like sauna if it's right for your client, exercise, and these kind of drinking enough water. These things are all really supportive of liver health. Okay, so there is some of the references there, and you can, if you're watching this live, you can maybe take a picture of it, or if you're watching on demand, you can pause it. But if anybody does want me to email them these references, I can do that, no problem. Okay, so we're going to have a few questions now. So if you just bear with me, I'm just going to have a look at the questions here. Okay, so the first question is, how long can you take milk thistle silly for on an ongoing basis, especially for those people that are regular alcohol users? Do they need to take a break? I'm not aware that you need to take a break from that. Richard, do you have any knowledge on that?
No, milk thistle is a gentle detoxification aid, so it's not going to be really speeding up processes, etc. So I think that's not going to be something that you need to stop. Obviously there is a degree of how much alcohol are people drinking, so that's an individual consideration.
Okay, great. So so they don't really need to stop after a while. It's kind of one of those things that is quite safe for the long term. And of course, if somebody does have chronic liver disease, then it might be a good thing for them to be on it for quite a while. What are the best ways to increase estrogen after the menopause? Would broccoli sprouts high in indole-3 carbinol? I suppose that's ID3. I think they mean indole-3 carbinol. Would that be the best way to modulate estrogen in perimenopause? Richard, what's your opinion on that?
Again, it's an individual case by case. So depending on the degree of their kind of estrogen dominant or unopposed estrogen symptoms, it's very important to really make sure that you've taken a good history and that you understand what's going on. So broccoli sprouts are quite potent. So I try to encourage food, the broccoli itself or other cruciferous vegetables. And then you can add in broccoli sprouts if you feel that there is a need. So if there's a high need for support for kind of getting rid of that estrogen and making your patients and clients feel better, essentially, then broccoli sprouts are a good way to go in and add in a bit of extra support on top of that. Yeah.
Okay.
So they are a good source of that indole-3 carbinol to be able to support our clients. Increasing estrogen after the menopause is very difficult. There will be a bit of estrogen production from things like fat cells, so that helps to sort of that's an evolutionary process. So once we start to stop producing estrogen from our ovaries, then there will be a bit of takeover from other places. Also, you can then add in things like phytoestrogens, so things like your tofu and flax seeds. That's going to help to a certain degree, but it's Mother Nature. It's a process that we are as women all going to go through, and there's a reason that we go through it. If as long as we don't go through it too early, that's a different consideration for things like bone health and heart, cardiovascular health, and even now, you know, the cognitive effects that we know about, immune system, you know, lots of different things. If you've gone till the average age of menopause is 51, so if we've gone to somewhere around there, near there, with having regular cycles, we're going to have that degree of protection from those hormones. So I'm not sure why would look to increase estrogen levels. I mean, if someone's having a lot of symptoms, then menopause therapy is an option for those people if they want to consider it.
Thank you, Richa. I hope that's answered Parsons' question. And also another one for you, if you don't mind, Richa, is about statins. Considering you're a pharmacist, I think it's a really good one for you. So considering that statins do block the production, the liver's natural production of coenzyme Q10, and coenzyme Q10 is needed for liver detoxification, have you seen any issues with people on statins then having impaired liver detoxification or anything like that?
So we can't measure liver detoxification per se. We can measure liver function, which is the enzymes AST, ALT, etc. And what does it say? On statins potentially can't process to stage 2 detoxification. So I think there would be a hindrance or a slowing down of the process. It's not going to stop it full stop. You can consider giving someone CoQ10. A lot of clients or patients, I do recommend that they take CoQ10 when they are taking statins, and because of the depletion. But in terms of answering the question, I don't think it's going to completely halt it, the process. It's just going to make it a bit more difficult. And so that, you know, we do need to consider that, as if they are presenting with symptoms, then we can sort of look at giving them maybe a CoQ10 supplement.
Perfect. Thank you so much for that, Richa. And of course, thank you for everybody that has attended. I hope you have enjoyed it. It's been great having you on. Again, if you do have any further questions, please do feel free to drop me an email. My email is on the screen at the moment, so you can just take a picture of that or make a note of it. We will be sending out a recording of this webinar, so if you want to watch it again, perfect. And of course, we're giving you the opportunity to try debloat and detox for yourself. So that is for live attendees only though, so you will get an email afterwards of how to claim that. And if you're watching this on demand, we're really sorry, but it is for live attendees only. And our supplements can also be purchased through the natural dispensary as well. So a lot of practitioners like to use a natural dispensary because it's a really easy way just to add Dr. Vegan products onto the supplement protocol. And of course, remind everyone, do sign up to our practitioner scheme. It's really good. You get free products, loads of free information, and loads of support with the clinic as well. So do make sure you do sign up for that. And thank you so much to Richa for being with us today. And I hope everybody's learned something and gained some value from joining on today. And I hope everybody has a fantastic evening. And we look forward to seeing you on our next webinar, which is about bones, bone health. And we've got a GP coming on who she specialises in women's health and bones health and nutrition as well. So that'll be really, really interesting. So look forward to that. Okay, thank you, everybody. I hope you all have a wonderful evening.
Thank you.